The views expressed by myself and the guests of this podcast do not reflect the official policy or position of the U.S. Air Force, Department of Defense, or the U.S. government. Welcome to White Coat Warriors. I'm your host, Dr. Chris Myers. And on this podcast, we talk about human performance optimization and training paradigms for you, the young medical professionals, and how you can use it in your own professional practices to help yourselves and your clients. Hey everyone, welcome to episode 8 of White Coat Warriors. Today we have one of my favorite guests and a great friend of mine, Dr. Katie Bauer. Before we get into it, just remember, if you like what we're doing, give us a like, tickle that bell, give us a 5-star rating on whatever platform that you're listening or watching us on. Every little bit helps. On today's podcast, we got a lot of areas to cover. We're going to talk about human performance and medicine, sleep. We're going to even talk about mentoring residents, which is a big one. We've been kind of building up to this. And Dr. Bauer has done it all. Dr. Bauer, she has a great background. But before I actually do any more of that, I'm going to let you introduce yourself a little bit. Katie, how you doing today?
I'm doing well. Thanks, Chris. And thanks for having me on your podcast.
Yeah.
So
tell us about yourself.
It's an honor to be invited.
Yeah. Well, it's all good.
I'm a wife and a mother and an associate professor of surgery, full-time acute care surgeon. I work at a level 1 trauma center in Virginia. What that entails is acute care surgery is made up of 3 subspecialties in general surgery. So surgical critical care, which is taking care of ICU patients, emergency general surgery, which is taking care of all the people coming through the emergency department or who have surgical emergencies arise on the units. And then trauma surgery, so taking care of injured patients who are in motor vehicle crashes or have gunshot wounds or any number of other mechanisms of injury. These services require 24/7 coverage of at least 60 to 100 patients in the hospital at all times. We take consultations from the ED and all over the hospital. We work in the OR, operating on people in the midst of all that. And it requires in-house call for one of us to be in the hospital at all times.
Okay. So I think that in-call is a really important point that we're going to touch on. But also the fact that the sheer number of patients, 6,200 or 62,000, that's amazing. I didn't even know that.
Oh, 6,200.
6,200. Okay. Yeah. Sorry. Yeah. Okay. A factor of 10 too much, but yeah, that's still a lot of patients. And why don't you, give us a brief description on like a typical day for you, with what you do in the hospital.
Okay. Well, it usually starts the night before or early in the morning of looking through charts and collecting data on the patients that I already know about when I get there. I meet with a multidisciplinary team of all different levels of trainings, all the way from medical students, all the way up to other surgeons. We have residents at different levels, and then we have advanced care practitioners like nurse practitioners and physician assistants that work with us. Okay. So we meet with them. We talk about the patients that came in overnight, the operations that need to be done for the day, and then any issues that have arisen with patients that were already in the hospital. We go and make rounds and see all those patients and do what we can to help them feel better and progress their care. Decide who needs an operation, who doesn't. We're taking care of people in the post-operative period. We're actively resuscitating people from different forms of shock. And then we spend, we go to the OR. There's usually 3 to 5 cases done in a 12-hour period. In between cases, we are running down to the emergency department to see consults or seeing other patients that need attention. And then if I'm on call that night, I stay the night in the hospital. That would take me to about 24 hours of accepting new patients. And then usually it's wrapped up around 30 hours after you complete all the, as much paperwork as you can and wrap things up afterwards. So then I would go home the next day and try to take a nap.
A nap. Okay. I would jog out for about 14 hours. That, a lot of that reminds me of some of the, a lot of the infantry operations I would do back in my army times. And it's interesting that you mentioned that because there's a lot of correlations between what you just said and with the tactical populations that I work with on a daily basis, right? So time management's one, stress, doing too many things at one time, and lack of sleep. One could argue that working in your professional environment equates to an extreme or an austere environment that a lot of tactical populations work with, right? And so you have to, you have to have particular skills, strategies to be able to manage all this, right? So talk to us about some of the methods that you've learned and try to employ that work or even fail in the past to kind of be successful and to get to where you're at right now.
Well, the gut it out technique, which is usually how we all start out as medical students, where those of us that want to go into surgery have a certain personality, and we say we'll get up early, we'll stay up late, we'll do whatever it takes, we'll stand for 14 hours straight and not sit down. We will we'll do whatever it takes to get through the day and get all the work done. That takes you to about age 32, and then you really can't physically do that anymore. So you have to start employing some other strategies. The gutted out strategy means you don't eat, you don't sleep, you don't drink. And that can really take its toll, the next day in terms of your recovery. Mm-hmm. So as I've gotten older, I've learned you have to pay attention to nutrition, number one, just like you would if you were in a long endurance race. You have to plan to have at least food or supplements available. I like to pack actual food, but that doesn't mean I'm always going to get to eat it. And so I've used some of the techniques I learned in endurance racing, like energy gels and ketones and things you can kind of keep in your pocket, and protein bars. So that helps. And then planning out, making sure you're taking in liquids. That's key as well.
I love, I don't want to cut you off right there, but it's interesting that you mentioned that. So especially keeping something small in your pocket, and of course, definitely pushing fluids. It goes exactly back to actually two of our past guests have mentioned the same exact thing back in our episode with Megan Louts, nutritionist. She mentions that it is keep it simple. Always try to keep something in your pocket. And in our previous episode, our guest said the same thing as well. And he's a professional triathlete. And he's like, I always have to keep a protein bar in my pocket when he goes through his rounds. He's a third-year med student at Ohio State. So,
yeah, protein's key. You can tell if you don't take in any protein for 24 straight hours, you really feel sick the next couple of days.
Yeah. Typically, from some of the anecdotal, some of the pilot studies I've read, the average medical professional intakes about 0.4 grams per kilogram of body weight per day. That's not even enough for protein synthesis in the human body. So you're going to go into a catabolic state, even if you are eating enough. So, yeah,
you almost have to take in more, just like as if you were training for an endurance event.
Yep. Yeah. And, typically it's, USDA says, 0.8 grams per kilogram. Many can argue it could be closer to 1 gram per kilogram. So, but either way, getting it in, doesn't matter the source as long as it's protein at this point, keeping it simple. So, wow. Yeah. So I love that fact that you're touching on that point. And you got more cognizant about it as you got older and more experienced. Especially with our time together, kind of training together for long endurance triathlons and stuff like that. We've both learned from each other on that one. With that, you've kind of taught me a little bit more about the importance of sleep, just from your professional schedule. And yeah, just knowing how you work, right? It's you sometimes put in multiple calls in a week in a 7-day period. How do you right, wrong, or worse, or for better? How do you manage that?
Not well. I haven't found the magic solution there. There
Okay.
was there was a paper published by Dr. Jamie Coleman. She's at the University of Louisville in October of last year,
Yeah.
and she what she did was she had acute care surgeons wear whoop bands
Okay.
for all the time while they were on call, not on call, and then she had them fill out subjective data and do surveys about burnout and illustrate what their call shift was like. Did you have a horrible event like a child die, or did you have a really hard case, or did you feel like you were stretched too thin? So there was lots of qualitative data collected at the same time.
Okay.
And what she found was that we have significantly irregular and disrupted sleep without evidence of sleep recovery.
Oh, really? Interesting.
Yep. And it's exacerbated when stressful events occur during in-house call. And both of these are linked with an increase of burnout, feelings of burnout and overall poor well-being. So when she started out to do the study, it was, some people said, why? We already know the data's going to show we're tired, right? But she said, we know this, but the first step to fixing it is to define it and to outline it. And get some data on it, and how tired are we really, and how much of an impact is it having? And so that was really the first data done on my population in terms of sleep deprivation. It's actually a pretty tremendous problem, because just within, if you work one night per week over a period of 10 years, for women, they have a 60% increased risk of breast cancer. And men have an increased risk of prostate cancer. There's an increased risk of depression, suicidal ideation, behavioral disturbances. So it's not a benign occupation.
Yep.
So there aren't really any solutions yet. It's just a matter of self-regulation, know your limits. For instance, we used to take every other night call. So you'd be on call Monday night, you'd work all day Tuesday, and then you'd be on call Wednesday night, and you work all day Thursday. I did that. I think the longest I ever did that was 9 days straight. My husband's a surgeon too, and he did it a little earlier than I did. He did it for 3 months in a row at one point.
Now, was that during your residency, or was that actually beyond? Okay.
Well, that was during residency. I've not done it since I've become an attending. I've never done more than 2 or 3 in a row. But even now, that was probably 10 years ago. Now I know I can't manage that. Yeah. Physically, I can't manage it. So we try to keep it to one call per week, sometimes 2 calls per week within a 7-day period.
Yeah. And how, coming off of that, so coming off your, your calls, how do you personally kind of self-regulate when you get home? Because like you said, you're a wife, you're a mother, you're also a long course triathlete. How do you manage those priorities and still trying to, recover from that 30-hour shift?
Well, the easiest thing is to skip the workout. That's step one.
Fair enough.
Although I find when I actually do the workouts you prescribe on those days, I feel better. But so it's, I learned I can't have any caffeine after 3 a.m. or I can't sleep in the afternoon when I get a chance to take a nap before, the school pickup and after school sports, et cetera, begins. I make sure that I have water, that I'm hydrated before I try to sleep. I learned not to ever schedule anything important on post-call days. So I will protect that time in terms of having meetings or setting myself up for obligations. Like I'm not going to be the snack person that day for soccer, for instance. So,
so in a sense, you're trying to, within reason, you prioritize yourself on that, that post-call time period.
Yes, that's what I try to do.
It's good.
That helps with recovery.
Mm-hmm. Yeah. And about, since you've learned that, about how long does it take for you to kind of feel back to normal, or as we would say in the exercise physiology world, back to baseline, coming back off of, coming off call?
So it usually takes about 4 to 5 days. And there's, for me to feel normal, then there's, and it has to be 4 to 5 days of getting good sleep. So about 8 hours of sleep, which doesn't happen. And in Jamie's paper, she demonstrated that we were getting, as acute care surgeons, like 6 hours of sleep when we were post-call. We were not making up that time. There's data out there that says you have to get 9 to 12 hours of sleep for 4 days straight to make up a sleep deficit.
Exactly.
Of, even 3 hours of missing 3 hours of sleep. So I feel that it's a good 4 to 5 days before I feel normal again.
Yeah. And I can't remember the exact paper, 2 papers off the top of my head, but they came out of Journal of Military Medicine that said the same exact thing, where they looked at Army Rangers when they went out to the field, and with an average sleep of 4 hours a day, it took about 4 to 6 days with the same sleep time range that you mentioned, up to 8 to 12 hours, to kind of get back up near baseline metrics. And so, it's good to see that the same theme, it can cross different populations.
Right. Yeah. My problem is the next morning that school still starts at the same time, so I still have to get the boy up at 6:30 and off to school before 8. There's no sleeping in.
Yeah, fair enough. Yeah. So, with that, so we've kind of, we're talking sleep and stuff, but, and the other thing that you kind of mentioned some of our previous conversations with this is the different stress levels that this can cause, whether it's just going in fresh, coming out of the job, but then with reduction in sleep and recovery, the stress levels kind of go up. How are you able to manage that, if at all?
Well, I learned what my limits were the hard way. I think we first started working together in January 2020, I think, right before the pandemic. So probably 6 months later, I started a part-time fellowship in medicine while I was still working full-time as an acute care surgeon. So I just rearranged my schedule so that I didn't have any time off at all. And I was also learning to swim because I didn't know how to swim, and I was actually pretty terrified of putting my face in the water. So it took a long time. Oh, it was pretty bad.
You make it sound worse than what it is. It was.
I don't think I told you about all of it, but so I would get up at 4:15 in the morning, swim from 5 to 6, and then go put in, 60 to 80 hours a week, sometimes hitting 90 hours a week. And I kept pushing through it. I said, well, on post-call, I'm going to do that bike ride anyway. Or, I need to get this extra run in. Let me get up an hour earlier than I would normally get up. So I was really sacrificing sleep in order to train. And I actually developed an ulcer, like an actual stomach ulcer in the midst of all that. So there were some other stressful things going on at work. Some of the things that cause people to have difficulty at work, bad outcomes that are out of your control, but you feel responsible for them. And, pressure from insurance companies and lawyers and that sort of thing that just make your job really hard to do. So everything kind of came together, and, you feel the effects of the severity of inflammation you have when you don't get enough sleep.
Yeah.
And so I learned the hard way. And then for the next race, we trained a little bit different. I wasn't working 2 jobs. I had a little more time to play with. And I think we did fewer training sessions and shorter, more intense training sessions.
Yeah.
In order to get it in without losing sleep. And then I was choosing to sleep rather than do workouts sometimes when I just couldn't fit it all in. And that worked out a lot better. That felt healthier in the end.
Yeah. Well, to kind of give everyone context, Katie and I were training together for a half Ironman distance. So it's like 70.3 miles when you do all three events, the swim, bike, run together. So this is kind of the training sets that Katie is talking about. We were training together for a couple of different Ironman, and they're in Virginia. And those are the iterations she's mentioning right now. And so, and that did really work. That worked really well. And that we're still kind of working with that paradigm at this point, where how do we finally figured out how your body adapts given all the stress, the limited sleep, but it's still maximized to the best you can do, nutrition and everything else. So it's definitely kind of keeping a steady state, but with that, it's all trying to keep a balance, right? And talk to us a little bit about that. Some of the insights that you've gained with this journey that we've kind of been on for the past 4 or 5 years together.
Well, some of the insights I've gained, you had me start using the wearables to collect heart rate variability data and recovery data. And so that was very interesting to see that objective data in terms of how exhausted I actually was. Sometimes I'd feel exhausted, but my numbers would look good and I'd do a workout and I'd feel fine. And other times I wouldn't feel as exhausted. My numbers would look terrible. And if I did the workout anyway, it wouldn't go well. So it was interesting to see that. But those sort of failed me because they have no way of tracking when you don't get any sleep. Most of my calls, I'm up all night. I don't take a nap. There's no, there's no sleep onset and there's no, time of awakening that they can calculate in their algorithm. So those days would not really get accounted for in terms of the overall exhaustion. Yeah. So somebody needs to develop a wearable that can count nights where you get no sleep. If we're going to collect data on people who do jobs like mine.
Well, even tactical professionals too. I mean, it's the same thing. Yeah.
So there were the wearables, and then, we experimented with some different supplements. We added the ketones in, and that made a difference. Haven't quite figured out exactly where those make the biggest difference, but I know when I just get to a point like, gosh, I should have had protein or carbs 4 hours ago, and that's all I have on me. I take that and I can go a little bit longer.
Glucose management.
That's the other. We're going to add in the glucose monitor too. We need to do that.
Yeah. So it's just kind of looking at again, it's nutrition, sleep and nutrition are kind of or everything. It's like you could be the best. You can study all day long. You can know all the techniques. You can have the best dexterity, but if you don't have those other two, everything else falls to the wayside. And so, with that, how do you, if this is too personal, please cut me off. How do you balance all this with, the family as well? Because, this is not something we've really kind of talked about in the podcast in the past, but we've not had a guest with your experience with this. You're, like I said, you're a multimodal doctor, assistant professor, the acute care surgeon,
associate
professor. Okay. Sorry. Associate professor, mother, husband, long course triathlete, now podcast guest, so you do a lot of it. Yeah. How do you prioritize like the family and all this?
Well, the family has to come first, always. That they go into the planning, they go into the calendar first, and then work, and then everything else. So my husband is a true partner. We tag team just about everything that has to be done in the house or with the kids. And so I wouldn't be able to do that if it was, a more traditional arrangement where I was responsible for everything in the house and he only went to work.
Okay.
That would never, I wouldn't be able to maintain my job. He knows he's done my job as a resident. And so he knows what I'm doing, and how hard it is. And he's learned my patterns of needing recovery. So he expects very little of me on post-call days. He knows he's going to have to pick up a lot of what's going on.
Yeah.
The kids know that sleep is sacred, and anybody in the house is sleeping. We're not waking them up for any reason unless there's an emergency. So that was ingrained from a very early age. That's good for everybody.
Yeah. I would love to pick your brain on that someday.
My husband does most of the cooking because he doesn't like what I make. So I got married and learned I didn't know how to do laundry and I didn't know how to cook. So it's worked out pretty well for me so far. But he cooks, and he makes sure that he has leftovers for me to take with me to work, because
I hear he makes a mean steak.
Oh, he ruins restaurants. There's very few restaurants I can go to anymore where the food is better than his. No, he makes sure I have food to take with me to work, because the food that's around a hospital in the middle of the night is not really fit for consumption if you want to, avoid a BMI that's too high and diabetes and all of that.
Okay. Yeah. Food. It's good. Pre-planning, you're hitting a lot. You're talking about a lot of the points, kind of talked across our entire season so far. That's great. But I love that. But we have not talked on that aspect on the family. Thank you for bringing that up and kind of touching on that. Now,
it's taking some trial and error.
Oh yeah, I can imagine.
Yeah. There was a while there where, things would get kind of explosive because I'm sleep deprived, and we didn't really know what the limits were, but over time we figured it out.
Fair enough. Yeah. I think that's with a lot of people too. But that's part of the journey. That's what makes it fun. Fun. For those who are listening, I just threw up some air quotes. But yeah, all right. Let's shift gears here a little bit. We kind of intruded on your personal life a little bit, and thank you for being open and honest with all that. You spend a lot of time training, a good chunk of your day training and mentoring, interns, residents, medical students, stuff like that. When we look at their performance, right? You had mentioned before, doing the day on, day off, and kind of volunteering for that. Do you still see that type of same types of choices, or even that type of culture in the newer professionals?
Oh, no, things have changed drastically from when I trained. There are strict limitations on work hours. They still work hard, and they still work long hours, and they still do overnight shifts, but they don't have the same, they don't do every other night. They don't stay all day the next day. When they're post-call, they go home by a certain time in the morning, usually by 6 a.m. or at the latest 10 a.m. If they've been there for 24 hours. So it's very different. And they don't take more than one of those overnight shifts a week if they're taking it at all. They have a night float system. So the residents that I see really struggling are the ones that are doing nights. They do it for a month, where they only work at night about 6 days out of 7 for the week. Yeah. So the ones that are successful with that, they flip their sleep schedule. They, have good sleep hygiene. They make it dark. They make it cool. They get up with enough time to have a meal like you would breakfast. And some of them even work out before they come to work. And then they go home and they sleep. They completely flip their schedule. The ones that I see struggle, it takes about a week or two to flip their schedule. They're tired enough they can sleep during the day. Their nutrition just gets destroyed because they really have to plan ahead and make sure that they have food with them when they come to the hospital. Because again, otherwise they're eating, French fries that are cooked in old oil and pizza that's
good
almost
right
not
now.
fit to be called pizza yet.
Yeah.
Or vending machine fodder.
Oof.
Um,
Yeah.
but
Cheetos.
they, yeah. You know, I see both types, and usually they get through nights one time when in their junior years where they struggle through it, and the second time they go through it a little bit smarter about it.
Okay. Trial and error.
Mm-hmm.
Yeah.
Yeah. It's really tricky for the residents that have families, though, for the same reasons. You know, it's hard to work nights with anybody who has families.
Yeah.
But they have to have support and an understanding partner at home. Though I have seen residents who are single parents do it. They make it work.
Okay. So it seems like there seems to be a couple of common themes that you've kind of mentioned through all this is, nutrition, keeping it simple, but doing some basic planning, to ensure that you can just meet your basic needs, whether it's just a regular shift or a full 24, 30-hour shift. Sleep, of course, we know that sleep, but I love the fact that you mentioned sleep hygiene. That's something we've talked about on this podcast inadvertently over the past 5 episodes, which is really interesting. But the social structure, that's the first, we've not really talked about that throughout the season. And I think that's really important, the fact that you brought that up. But it seems like just even your personal experiences and even with the new generation of medical professionals, the same themes seem to still apply. What would be your thoughts on that?
Well, even though the work hours have gotten better, they're still not normal in the sense that our bodies are made to sleep at night, not work all night, and they're still withstanding the stressors of doing a physically and emotionally intense job while sleep deprived. So I'm not sure that the improvements in working conditions have made that much of a change. We still need to find a solution to this problem, because the people that are doing these jobs are not in them very long, because it's not really sustainable. And if they do stay in them for a long time, they end up sick because of it.
Okay. Interesting. So, yeah. So, I mean, yeah, you know what? I can't come up with anything off top, but that's a very powerful statement. So with that, if you got a platform right here, we have plenty of listeners. What if you had 2 or 3 pieces of advice for the new crop of medical professionals coming through the ranks right now? What type of advice would you impart on them?
Well, I guess when you're coming up and first learning about all the different subspecialties in medicine, you have to figure out if you have the stamina to withstand the pressures that go along with being a surgeon or a trauma surgeon. Start using those wearables, whether it's a watch or a ring or a band, and start paying attention. Even if you're not an athlete, start paying attention to your sleep cycles and how different habits affect your recovery scores. So for instance, if you're drinking more alcohol and coffee than water, you may see those scores dip a little bit. You need to go into the profession.
I laugh because you know how much coffee I drink.
Yeah. Physically and emotionally prepared for it. When you're a student and you're doing rotations and you're trying everything out, pay attention to that data and see how you tolerate it. If you're having trouble staying up all night as a student, and the rest of your life is really struggling because of it, it's not going to change when you become an attending, not much. Some people are more resistant to the effects of sleep deprivation than others. Now, it affects all of us, but some people really struggle with it more than others. So try to figure that out before you sign up for a job like this.
Okay. Well, excellent. Oh, that's very powerful. You know what? Let's cap it right there. I mean, you can't get any better than that. So Katie, thank you so much for your time. It's always great to talk with you. Even, when we're talking just triathlon on our weekly meetings, I always still learn something. So thank you for that. And I guarantee our audience would thank you as well. So if you got any, and to our audience out there, thank you very much for listening this season. We'll have more in season 2. If you have any suggestions of what you'd like to hear, please write us at Influent. Thank you for your time and have a great one. Cheers.
Thanks, Chris.
The views expressed by myself and the guests of this podcast do not reflect the official policy or position of the U.S. Air Force, Department of Defense, or the U.S. government.